Hi, I'm Tom Haney, and in this presentation I'm going to try to give you information that may help you to stay fit and healthy and avoid injury. Now before we get underway, I'd like to tell you that for credit from the LMHF Wellness Program Part 2, you must watch the video in its entirety, watch to the end, and then make a comment on each video with your name. Once confirmed by LMHF that you have watched the video in its entirety, your comments and name will be promptly removed. Thank you and enjoy. This presentation is about avoiding back injury by being very conscious about your posture and your lifting technique. I'll do my best to describe these things, but ultimately it's going to rely on you to do these, to take them to heart and actually apply them in your work environment. Quick disclaimer is this is designed for informational purposes only. What do I mean? I mean, if you have concerns or question or have already experienced some sort of an injury or aren't sure that any of this applies to you or some portion of it, talk to your personal health care provider. That's the person who knows you better than anyone. And in no way is this meant to be or the creation of a physician-patient relationship. This is purely information to try to help you to make some decisions. So I want to give you a basic fact. Back injury is one of the most common, most debilitating, and most expensive of the worksite injuries. If you've ever experienced a back injury, you know, and we know that it's a serious issue and fairly common. That's the problem. So there are a lot of activities that take place at work. Lifting, carrying, pushing, pulling, holding. All of these things expose you to certain amounts of strain that could result in some sort of an injury if not done properly. What we've done is we've been able to narrow down 6 risk factors that we want you to be sensitive to as you're doing your work to have the ability to reduce your risk. For example, force. How much effort's involved? Is this a heavy load? Whether you're lifting, carrying, pushing, pulling, grasping, pinching, or striking, do you have to do it with a great deal of effort? That's a concern. How about repetition? Well, we know repeated efforts can also lead to fatigue, which can lead to injury. So is your work something that requires you to do repeated efforts in a fixed short period of time? There are environmental considerations that you should always look at. Hot, cold, light, noise, dust, and fumes are a few of those. The duration. What do I mean? I mean, there has to be a reasonable balance between work or effort and recovery. If that is balanced correctly, you will be able to recover from the effort that you're putting in and not have it build up over time. And then posture, and that's a big part of what we're going to talk about today. Aligning your body. There are positions where your body is both stable and strong. And if you do work in a stable, strong position, you have a much lower risk of injury than if you would do the same task in a weak or unstable position. But you need to understand what those positions are. So let's talk about some of the type of back injuries. Well, certainly there are soft tissue injuries like sprains and strains. That's where a muscle, a tendon, or a ligament is overworked and may lead to some sort of discomfort or pain. And then there's disc injury, whether it be a bulging disc or a herniated or ruptured disc. Those are concerns and of course can be extremely painful and are very serious injuries. So a basic statement is that the number one cause of most back injury is what we call cumulative trauma. What do you mean? I mean, it's not the single effort that happens, it's the series of efforts that happen over a period of time. And that time could be days, weeks, months, or years that gradually causes your body to break down and leads eventually to an injury. So we know that improper lifting is a big part of this. If you attempt to lift loads that are too heavy for your back to support, it may cause damage to your discs, and that of course is the most serious of the back injuries. Is disc-related injury, so let's focus on that for just a second. First of all, again, as I mentioned, it is the result of cumulative trauma. It's not just a single effort, but rather by doing things that are required of you at home or at work that are causing you to sprain, strain, or injure your back in some fashion. Even if it's undetectable early on, it's the cumulative effect that may ultimately lead to an injury. So proper posture and body mechanics is a very big issue, especially when it comes to avoiding back injury. Your body is designed so that it has very stable positions if you put your body into those positions before attempting to do heavy work. Poor posture and faulty body mechanics can lead to back injuries, no question. So let's talk about your spine. Now your back is everything opposite your front. That's a lot of muscles and blood vessels and tendons and ligaments, but we're going to focus at the moment on disc injury, which relates to your spine. Your spine is composed of a series of bones called vertebrae that are stacked on top of each other, but they're separated from each other by a spacer that we call a disc. Now your spine is the main supportive structure of your entire body, and it's the protector of your spinal cord. The discs are the cushions that exist between those vertebrae, and that's what can become injured. Here's a side view of your spinal column. One of the features of the spinal column that's important to understand is that your spinal column has three natural curves. One in your neck or cervical spine, one in your mid-back or thoracic spine, and one in your lower back or lumbar spine. And those curves and the maintenance of those curves are critical to preventing damage to the discs. So we're going to focus on how can I do my job and still be able to maintain those three curves. Let's see if we can make some points. First of all, let's talk about the disc. You may have heard at some point somebody refer to a slip disc. There's no such thing. That doesn't exist. What really happens to a disc, let's start with its design. A disc has an outer wall that's fibrous in nature, and the interior is a gelatin-like substance that provides some of the shock-absorbing characteristics of your spine. But the front wall of the disc is extremely thick and very strong. The back wall of the disc is quite thin and not very strong. That's the basic structural design of your disc. Now the disc sits between the vertebra, and behind it is your spinal cord and the nerves related to the spinal cord. So what happens over time if you do not use proper postural positioning, you push that disc material towards the thin back wall, and eventually those fibers will stretch, causing what we call a bulging disc. Now that bulge can eventually turn into a herniation, which means that some of the fibers have actually broken, or it can progress into a ruptured disc where enough of the fibers have broken that the material inside the disc actually spills out. Now the concern we have is that those protrusions, bulges, herniations, or ruptures, eventually will come in contact with one of the nerves exiting the spinal cord, and that's where the pain comes from. And it becomes serious levels of pain, and trying to reduce that is a significant issue. May require anything from rest to physical therapy, injections, or surgery. We don't want you to have to experience that. We want you to avoid the process from the onset. There's just a depiction of what happens is that as that bulge or herniation protrudes through the thin back wall, it protrudes into an opening in your spinal cord or column called the foramen, and that's where the nerve is, and that's where the pain comes from. So what's the posture? That's what we really want to talk about. How to align yourself properly, put yourself in the most stable and strong positions. First of all, if your job requires you to sit for long periods of time, here's the basic way that you want to design your workstation to sit properly. First of all, you should always try to maintain the three natural curves. That might require or might be helped by having an ergonomically designed chair with a support in the lower or lumbar back to help maintain that postural position. Your feet should always be supported. They shouldn't be dangling off the end of a chair. Your ears should be over your shoulder. What the heck does that mean? Well, it means what we want is that your head is back and aligned with your spine by keeping your chin tucked, and so that the ear remains over your shoulder instead of allowing your shoulders to round forward and put you in a forward head posture. There's some postural pictures, exaggerations of rounding forward, exaggerations of pushing backwards, and then a neutral spine position where ears over the shoulders, shoulders are in a relaxed but back position, shoulder blades are somewhat pulled together, and a plumb line from the ceiling would go through your ear, your shoulders, your hip, your knee, and your foot. That's the ideal position. Now let's talk specifically about lifting, since that seems to be an issue for a lot of people. First of all, let's talk about back lifting. I think most people at this point would know that this is wrong. You're not supposed to ever just bend over at the waist and pick something up. It puts an enormous amount of stress on the two lower lumbar discs, and those are the two that are most susceptible to injury. And although we know better, we know it's not right, we tend to do it all the time. This happened to be a picture I took of someone just doing their regular job and realizing how easy it is to fall into that pattern. If you bend over to pick up things that are dropped on the floor, you bend over to pick up your kids, bend over to get something out of the bottom drawer. It's always wrong to simply bend over at the waist. So what we did years ago is created a description of a lifting technique that we thought would put people and make them much safer. And we gave them instructions like this. Keep your feet shoulder width apart, keep your back straight, which really meant was keep the natural curves. Bend your knees and lift with your legs. That was the key to how we were teaching lifting. And we even showed pictures that showed people doing a back lift, which was wrong, and doing what we just described. Now we found that there were some problems with that. And the problems related to the fact that, first of all, we noticed that people weren't doing it even though they knew better, and we wondered why. So we started to analyze the lifting technique. When we gave people the instructions that would have amounted to a squat lift, this is what we saw. They tended to squat down, which meant in many cases they would rock up onto the balls of their feet, which was not very stable. They would bend their knees down to the full 65 degrees, which is a very weak range of motion for your legs. Your legs are strongest when your knees are between 90 degrees and 180. And as they get down lower than that, it becomes very weak, and people don't feel comfortable or confident in lifting from that position. Also, the load was significantly distant from their center of gravity because the knees are in the way. You can't get any closer. So we said that this may not be the ideal way to lift, so we tried to come up with some alternatives. One of the alternatives is what we now call sumo style of lifting, and here's the basics. Instead of approaching from the side, which would be typical of what we would do if we were going to lift something, we suggest you approach from the corner. Why? Well, because when you approach from the corner, it gives you the option of having a very wide stance. It means you can get closer to the item you're lifting, which puts it closer to your center of gravity. We want you to keep your knees above the 90 degrees. Keep the three natural curves in your spine. And if you lift your head and your torso as a single unit, you tend to, because your knees aren't in the way anymore of lifting, you tend to be able to lift straight up and down like lifting like an elevator instead of lifting like a crane. So now he could have actually probably moved in somewhat closer, but you can see his approach from the corner with a wide stance. That meant his feet were flat on the floor, his knees weren't bent past 90 degrees, his back was in its normal three-curve position, and by lifting with his head and chest at the same elevation, he was able to lift like an elevator instead of like a crane. That's what you should be aiming at in terms of lifting something from the floor. Handles. Handles provide an opportunity for you to grip something so securely and put yourself in a stronger position. So, of course, if there are handles on what you're going to lift, generally they're located near the top. The picture of happens to be father and daughter there, is that even children have natural handles under their shoulder, under their armpits. By lifting from that position, or in a case of something with handles, using those handles allows you to adjust your position and have a secure grip. If there's no handles, or in the case of a container or a box, you can tilt it towards you, same position, but tilt it towards you so that you've elevated one side off the ground so that you can use the corners and edges as places to grasp as handles. Now, if you have a tall item, that might make it difficult to use that particular technique. But in this case, what you do is you push the item away from you and step around it. By doing that, again, you've elevated one edge off the ground, and by using the other hand, you can control the weight and the substantial mass of the thing that you're lifting. These are particular techniques that you can apply in most cases when you think about what it is you're lifting. The golfer's bend. Okay. What we noticed with golfers is often when they went to get the ball out of the hole, if they ultimately got it in the hole to begin with, they would, instead of bending over and grabbing the ball out of the hole, they would put their hand on the end of the putter, stand on the opposite foot, and then bend over in that position. What does that do? Well, one of the things that we discovered is if your hand is supported on a firm object and you're balanced on the opposite foot, the rotation that you experience doesn't happen by rounding your spine, it happens by rotating at the hip. And that's what we would like to see. So whether you're picking something up off the ground, a light object, getting something out of a deep bin, getting something out of the back of your pickup truck, by supporting with one hand and balance on the opposite foot, it allows you to extend your reach without rounding your back. That's the key. Tripod lift. One of the things that we've discovered is that a very stable, strong position is when you are dropped down to one knee. In that position, you have 3 points of contact, which makes it very stable. It allows you to get things that are maybe difficult to reach more comfortably because you're in a more stable position and can maintain that neutral spine. And to get up from that position, you can take the weight of the object, place it on your thigh, on your knee if you will, and then by pushing down on it, you can push yourself right back up to the standing position. Again, these are techniques that we use a lot, and it's because it works. It allows you to be able to do things in a far more stable, strong position. This was an example of where we had somebody dropping down to one knee to work on tires where they have to be close to the ground, but we want them to be in a stable, strong position. Manhandling a tire mounted on a rim is pretty substantially heavy, and this would allow them to do that comfortably. Lean support technique. Well, this is the result of having an object, some sort of an object between you and the area that you're trying to work in or lift something from or place something in. And an example for me would be the trunk of a car. That in the trunk of a car, typically what we do is, because we can't get too close, is we round our back, bend over and grab something as we put it in or take it out of the car. Bad position. We're weak, our muscles are exposed to injuries, and our discs are fully exposed. So what do? Well, if you simply press your thighs into the bumper, what you've done is you have changed the mechanics, because now the focus or fulcrum is at your thighs, not at your lower back. By doing that, it allows you to keep a neutral spine position, making you much stronger, much more stable, and much less likely to incur any sort of injury to soft tissue or discs. Bracing. Anytime you can use the strength and stabilizing that would be provided by your hand or arm on a solid object, it widens your base of support and it takes pressure off of your spine. So by using either your own body, in the case of a person there pushing on his own leg, or a sturdy object, it allows you to be able to use the strength and stabilizing of your upper body along with the strength of your legs to lift something or to raise your body up or down from the ground. 3 serious considerations when you really look at the job you're going to do. You want to avoid heavy lifting. Now, heavy is relative. If it's heavy for you, but with another person helping you, it becomes not so heavy, that would be a consideration. Heavy can be a lot of different things, but you need to understand if it is heavy for you, it is heavy and exposes you to some danger. Frequent lifting, when you have a job or are doing a task that requires frequently putting yourself in an unstable or weak position, that's a concern. Or awkward lifting, or stacking or piling or moving things from one position to another, that can put you in an awkward position that also exposes you to some injury. Give you some quick tips and we'll wind this up. One is always get as close to the load as possible. You don't carry things at arm's length, you carry them in close. When you use that wide stance, somewhat straddling the thing you're going to lift, that puts it under your center of gravity and it's far more safe. Avoid lifting very heavy objects from the ground. If they're below your knees, that really exaggerates the risk. Try to find a way to get them elevated. Stacking things, forklift, and pallets can all help in the process. And if you are faced with a load that you think is too heavy for you to lift safely, get a mechanical lifting device, break it down into smaller parts before lifting it, or ask for help. Nobody wants you injured. Always maintain the 3 natural curves no matter what you're doing. Sitting, standing, lifting, carrying, pushing, pulling, all of those require that you keep your body in the natural 3 curve position of your spine. Tighten up the abdominal muscles as you lift. And if you don't have any good abdominal muscles, a little exercise can help with that. Move your feet to change directions. Don't twist your spine, but rather use your feet so that you can change directions if you need to turn a corner or to place something from one position to another. Never twist your spine. Stay in good physical condition. I know that requires effort, but it's worth it and will pay long-term dividends. And stretching and loosening up before work, just as we do with athletes. We warm them up because it reduces the risk of injury. Warm up, stretch out before you start heavy work. And thank you so much for your attention. Good luck and stay safe.